back, everyone. Well, varicose veins, they're not only unpleasant to look at, they certainly can be very painful, too.
But you don't have to live with them. In fact, at Vein Centers of Connecticut in Madison, they offer a new way of getting rid of these veins that will have you on your feet doing the things you love most almost instantly.
Melissa Cole went to the doctor-owned company to learn more.
Dr. Alfred Gladstone and Dr. Wanda Kirejczyk have been treating varicose vein disease for over 16 years here at Vein Centers of Connecticut in Madison.
We treat everything from superficial spider veins, which may be cosmetically unattractive to someone, all the way to most complicated vein patients, which include ulcers and bleeding.
The doctors say aching, painful legs shouldn't be part of the aging process.
A lot of people just accept that their legs feel terrible. Very classically, somebody will come to see us and they'll have varicose veins and they'll say, oh, I really don't like my veins. And then as you start to talk to them, suddenly you're getting all this other information. My legs are tired at the end of the day. They ache, they're swollen, I have to rest. I can't play with my kids after I get home from work because I have to lay on the couch and put my legs up. I'm in so much pain. That's all coming from their vein issues.
Turns out that women are more apt to get this, especially after pregnancy. So 80% of our patients are women.
The other 20% are men, like Stan Shevchak of Old Saybrook.
I started about 10 years ago. I have a right leg. I couldn't figure out what was going on, but I coming across Dr. Kirejczyk, and I asked for checking my legs, and come to find out that one of my veins something was wrong. And we did the procedure, and it was phenomenal result.
10 years later, the same symptoms appeared in Stan's left leg, so he came back for a second procedure.
So Stan had very classic vein disease. He had backward blood flow in a main vein in the thigh, causing pressurization of the veins downstream. And so he developed some varicose veins in the leg, and he had all of the classic symptoms: aching, heaviness, trouble sleeping, pain at night, needing to elevate that leg. And the elevation, what that does is tries to empty out that vein, so people do get some temporary relief. But now we've treated his leg, and we have removed those varicose veins from his leg. So we're keeping our fingers crossed he's going to feel as phenomenal on this side as he did on the last side.
And it's pretty instantaneous, right, when you get this procedure done?
Yeah, they feel better very, very quickly.
Vein Centers of Connecticut offers the newest way to treat varicose veins.
The latest and greatest thing that's come about in the vein world, which we're really excited to talk about today, is glue. We now have medical glue to be able to close the vein shut.
After a local numbing agent is administered, this tiny catheter gets placed inside the vein.
Once the vein is catheterized with this tiny little tube, we then deposit glue as we remove the catheter painlessly, sealing the vein instantly. The advantage is the patient can go back to their normal activities as soon as they get off the table.
Wow.
It's really marvelous.
No downtime.
No downtime, no.
With this way of glue sealing the vein, there's no need to wear compression stockings after.
What do you say to people who are watching who are kind of nervous to get this done?
Don't be afraid. Just come over and keep checking your veins. It's help.
And I always tell people, after you have it done, you're going to stand up and go, that's it? That's what I was nervous about? It's fantastic. It really is. It is very minimally invasive, almost no pain, almost no discomfort, no downtime. Actually, people often tell us I'm sad I only have 2 legs because they would actually love to come back.
Is it a one-time thing?
Depends on how many veins are abnormal in the leg. That's the key thing. But the recurrence rate is very low. When we treat a patient, we treat everything that's wrong with them to make them feel better and look better.
So now is really the best time to get it done.
Perfect time.
Pants season.
That's right. That's right. Before shorts season comes.
Shorts.
He's in great shape, active, exercises. He needed his legs to match the rest of him, and now they do.
Thank you.
All right, for more information, visit ctveindocs.com. There are locations in Madison, New Britain, and Wallingford.